Hello everybody, this is Dr. Kim. Today I would like to answer the question, is it safe to go to the dental office during COVID? I would like to give you my honest answer, and that is yes, it is safe to go to the dentist during COVID. However, you have to be very careful uh, and just listen to your government officials in your area as well. And I would like to explain why it's safe to go to the dentist. Well, and you'll notice if you have a dental appointment, the receptionist will ask you if you have any symptoms such as like runny nose, cough, those things. So there's screening questions. And when you do go to the dental office, generally you're in a room and the dentist and the assistants, they have the masks on and most likely like a protection with the face shield and everything on. So the risk of the dentist or the dental assistants and receptionists uh, creating aerosols for potential exposure is very low. And most likely if the dentist, receptionist, or dental assistants were feeling any symptoms, they would not go to work. And I want to emphasize I am currently working in Ontario in Canada, and I can comment on my area and where I am working. So, so yeah, and also one important thing in Ontario is that the regulatory body, which is the RCDSO, that gives licensure to the dentist, they um, they they require follow time in dental offices. What this means is that after a patient is finished with the procedure, and generally most procedures in the dental office setting is aerosol generating, meaning that with the air water syringe or the hand pieces, there's droplets of from the patient's mouth that the aerosols that generates, and which could fill the room as well. There's a follow time, meaning that after that patient is dismissed, there's generally like 15 to 30 minutes where the room is just left alone, and after that room is cleaned up so that all the aerosols that's generated is cleaned. So this is a really good because even if it's possible that patients that come to the office may be showing no symptoms, but we've heard that with coronavirus, even asymptomatic people can potentially pass it on. So the fact that there's like a follow-up time is really great because even if there was aerosol generated with the coronavirus, theoretically it's all been set, and then everything can be cleaned. And most dental offices in Ontario, they have like the air filtration as well, which really helps expedite to clean the air. And even if there was potential coronavirus in the air, we hope that the air filtration would clean all of that, and then the follow time is an extra time where it's cleaned as well. And one good thing with the dental office is that we are really limiting the how many people sit in the reception area. So in some cases, we have the patients waiting in the car, and then when the room is ready, we call the patient and then have the patient come in. So there's a lot of ways and safeguards to truly limit the risk of transmission of coronavirus. And just with anything, anytime you're not home and you're going out, if there's interaction with others, there's inherent risk of getting coronavirus. But I would say that compared to other areas, other parts that you can go and interact and do things, I would say the risk is quite low in terms of getting coronavirus. Uh, I can't say for certainty it's like a 0% because just the fact that you're going outside of your home and interacting with other people, it does generate risk of getting coronavirus. But I do want to emphasize that compared to other things that you can do, the risk is like relatively very low. And and I really want to emphasize, really truly listen to your government officials, because currently today's date, when I'm filming this, is November 21st, 2020, and on November 23rd, Toronto and the Peel region, which is in Canada, it's going to a lockdown. And in April and May of this year, when there was lockdown across the province, basically the dental offices were only limited to taking care of emergency patients. So I think that with Toronto and Peel region, most likely, starting Monday, they may have to just treat the emergency cases. So definitely, as patients, you definitely want to listen to the government officials wherever you're in. So make sure you follow what they tell you. And yeah, just in this video, I really do want to say that always be careful, okay? Even though dental office is like a safe place, you want to make sure that you have your mask on really well and it's tight. And if you're feeling any symptoms, and if the dental office is giving you a call, and if you wake up all of a sudden with a sore throat or runny nose or cough, don't be afraid to be honest with your dental office and just let them know, hey, you know what, I am feeling the symptoms, so I'm gonna have to postpone my appointment. Feel free to do that, because that's what the dental offices are asking you to do. That way it limits the exposures to everybody. And just please be safe. And just want to say that if you have any other questions, do ask me. And please like this video for YouTube algorithm, and please subscribe for the YouTube algorithm as well, so hopefully more people can see and be educated, and do our part in limiting the spread of the coronavirus. So I hope you have a nice day, and take care. Bye.